This is the UNC12 Probe. Primary function is to detect the periodontal pocket to determine the health status of the periodontium to see if the tissue is healthy or diseased. This is the handle, this is the terminal shank, and this is the working end. You can see that the working end is blunt and it's rod-shaped with millimeter markings. The working end and the shank are greater than 90 degrees. The way to read this is that once it enters the sulcus, the first reading would be a 1 millimeter. Anything after the first marker is a 2, anything after that is a 3, and 4. A 4 is at the bottom of the big line, and a 5 is at the top. And then it goes 6, 7, 8, and then this big line right here, that would be at the bottom would be 9, and the top is 10, and then it goes 11 and 12. The indications for this tool is the probing depth, the clinical attachment level, relative attachment level, bleeding on probing, demarcation of the mucogingival junction, amount of the keratinized gingiva, amount of the attached gingiva, gingival recession, furcation invasion or involvement, size of atypical or pathologic lesions, and the distance between the teeth. Contraindications for this instrument may include periodontal pockets in severe periodontal disease, periodontal pockets in areas where aesthetics is critical, deep intrabony defects, patient at high risk for caries, severe hypersensitivity, or patients with no teeth. Using the probe, the direction that you want to go will be from the right part of the maxilla to the other side. So it'll be 1 through 16, and then back on the palatal side, it'll be 16 through 1. Then you're going to do the same thing for the mandible. You're going to do 32 to 17, 17 to 32 on the lingual side. And you're going to remember that each tooth has 6 surfaces that you're going to probe. So 3 on this side and 3 on the palatal side. So it goes the distal line angle, distally, distal line angle to mesial line angle, and then mesial line angle to mesially. So you're going to do that for every tooth. Remember, when you're going this way, you're still going in this direction. So once you get here, it's going to be the mesial line angle mesially, mesial line angle to distal line angle, and then distal line angle distally. Just be aware that if you're probing on a real patient, once you reach the junctional epithelium, it's going to blanch. Using this instrument, the probe is kept in contact with the tooth surface, and you're going to do a walking stroke, and the angulation, the probe will always be parallel to the long axis of the tooth, and then tilted away from the tooth so it can be angled into the sulcus. You want to use a light grasp and light pressure with the probe tip against the junctional epithelium between 10 to 20 grams.